afterwards. So Ed will be pressing the record button straight away, I'm sure. As usual, any questions and comments in the chat, please, and we'll collate them and address them at the end. And as always, we do want to hear from you, so please do share your thoughts and questions with us. So first of all, Happy Jewish New Year, Rosh Hashanah, to all our Jewish colleagues. And the Jewish New Year started yesterday. And also this week is the start of rescheduled organ donation week. So I'm sure there'll be lots out of information and things happening in relation to that too. And as well as that, today is National Lumberjack Day. So lots going on this week. So I'll just move on to the tactical update. So last week, information coming through is that we're seeing slightly higher number of COVID positive patients. However, the nosocomial rates are falling. That's where we're passing it on to patients in hospital, and that's down to everybody's hard work and the use of PPE and isolation. We attended operational IPC this week as a children's hospital to allow the CAT unit to move to its normal patient flows, so pre-COVID patient flows, which is going to make a massive difference to the flow of patients. So we're not segregating patients red and green, we're just using the usual isolation pathways, and we start that from today. The MPX numbers are falling, and there is a bit of concern around CPE outbreaks. It's a multi-resistant, drug-resistant organism, and there's 3 outbreaks in the adult wards across the trust, either LGI and St James's. There's some new guidance in place to stop transmission. Obviously, we need to just be really careful and watchful within children's, because we do know that we're having significant outbreaks within the children's hospital as well for various IPC reasons, not CPE. In relation to pharmacy, there's a workforce transformation across the whole system to standardise processes and improve access to medicines and medicines optimisation. So there's various work streams. An EDAN rewrite programme to improve the amount and quality of information when transferring patients between sectors, opioid deprescribing, diabetes transformation, some work in relation to assessment areas, and a clinical value programme to try to drive down costs by working in a more joined up way across the system. Unplanned care board, a lot of work going on to improve care for our unplanned patients, alternatives to attendance to hospital, alternatives to admission, appropriate patient placement should they need to come in, and daily management of patients who are admitted to ensure as little waste as possible in the pathway, and also continued focus on discharge. Our bed occupancy within the whole organisation remains very high at 97 to 99%, and that's a reflection on the number of long stay patients that continue to be in the bed base. And we in children's are not immune to that. We do have a considerable number of patients that are here with us for over 30 days. And looking at alternatives to admission, and looking at our way we use our assessment areas. There's also some work for us in children's going on in relation to PZD and whether they can observe patients for a 4-hour period rather than direct transfer to the CAT unit. So we'll keep everybody up to date on that. And then me again, with operational pressures for the week gone and the week ahead, continued pressure really in relation to capacity. We come into the mornings with very little capacity and numbers of patients to place that require surgical procedures, along with the fact that we're seeing high levels of sickness at the moment. So a continual juggling act to make sure we do the right thing for our patients at the right time. And the pressures in paediatric critical care remain the same. And hand over to you, Suzanne, for finance.
Thanks, Celia. Just short and sweet from me this week. So from a financial perspective, we remain in an amber position. We're about £1 million away from where we need to be. However, that's considering we had an additional mitigation target added to our already significant waste reduction target, which the mitigation was around 850,000. So it does show that we would, if we weren't doing such fantastic work in terms of waste reduction and reducing waste, we'd be in a much more serious position than we currently are. So our gap remains at £1 million. We continue with the waste reduction programme, which is going great guns. We've also got an eye on next year as well in terms of our waste reduction programme. So the plea is, once again, any ideas, no ideas too weird or wacky or big or small, anything that anybody can think of or wants to just talk through, then please do so. And Liz and Kirsty are the experts in the field as our leaders for the waste reduction programme. And I think Liz is going to give us a bit of an example of one to try and spark some ideas. Thanks, Liz.
Thanks, Suzanne. Hi, everyone. I'm Liz Smith, Business Manager for Quality Improvement and Waste Reduction. And today, I'd like to share a really nice example of quality improvement and waste reduction. And I'm sharing on behalf of Maria Coveney. Sorry if I've pronounced that wrong. Maria is a family care sister on neonates, and Maria started in post earlier this year. And one of the things she identified that she wanted to do early on was to redesign the My Journey booklet that each baby gets when they're on the unit. And the reason for wanting to redesign it was that she'd had feedback that it wasn't being used enough by families and staff, and some of the staff thought the booklet was too long. So in response to the feedback, the layout's been changed, some sections have been reduced, others have been expanded to ensure it's more useful to both families and staff. And the result of the changes was that the booklet's actually been reduced by 10 pages as well. So this has resulted in printing cost savings of £1,050 per year. But most importantly, I think it's, the improvements to the booklet that have been based on the feedback of its users. So hopefully, while it's costing us less, it's actually more useful. So yeah, thanks, Maria. That's a really great piece of work.
Thanks very much, Liz. So lessons learned. I'm talking through this on behalf of Anna Dennis, who is off today celebrating her son's first birthday. So this relates to the newborn hearing screen. We are managing to miss a number of our babies that transfer from neonates into our wards that are not getting their newborn hearing screen. We do find that this happens in phases. There is so we do really well, and then all of a sudden we seem to sort of go off the boil a bit. But there is an alert that comes up on PPM. But I guess the message for everybody is, if you've got a patient that's transferred from neonates into one of your wards, then and you're taking over that care, you do need to check whether they've had their hearing screen or not. There'll be lots of communication coming out about that as well. Okay, so I'm going to move on now to sharing success, and we've got Kate Brennan on, who's going to talk about the Centre of the Obesity Service. I won't give it away.
Thanks. Hi, everyone. Good morning. My name is Kate Brennan. I'm a specialist children's dietitian in complications of excess weight and the obesity service. So I'm on to tell you today about the recognition that we've been given from the UK Association for the Study of Obesity. So the Complications of Excess Weight Clinic at Leeds Children's Hospital has been awarded as a UK Centre for Obesity Management by the Association for the Study of Obesity. The association is one of the UK's most foremost charitable organisation, so it's dedicated to the understanding, prevention and treatment of obesity. It has a network of centres for obesity management, of which we are now one, which is aimed at strengthening and advancing the evidence base, improving practices and influencing policy for the management of obesity within the UK. So we got it because of the excellent work that we've been doing within our new Q service. We are a multidisciplinary team. We treat and manage the complications of excess weight, and we have a strong focus on data collection as well. In terms of the relevance for Leeds Children's Hospital, we're the only children's hospital in the UK to have been given this accolade. We are now part of a network implementing state-of-the-art evidence-based care for patients with obesity, and we'll be continually networking with the association's clinical practitioners, the researchers, policymakers, with the aim to improve obesity management in the UK. And in terms of our ambitions for the future, we're currently waiting to hear back whether we will be recognised as a European comms centre. So that would obviously be another huge feather in our cap, and it would recognise Leeds Children's Hospital as an international centre of excellence for managing and treating childhood obesity. So watch this space.
Thank you so much, Kate. That's fantastic and really uplifting news to hear on a Monday. Thank you very much, and great work to the whole team. Okay, any other business? We have Suzanne, do you want to talk about Super Saturday?
Yeah, there are a couple of things I was just going to plug, if that's all right, Celia. So one of them is Super Saturday. So you'll know that we've done 2 really successful Super Saturday events in the past, and the next one is coming on the 12th of November. There'll be another one in March, but we're just focused on November currently. So this is an opportunity for anyone to try, or any teams to try, any innovation, doing things differently. There is funding and managerial support available to help get some ideas off the ground. So we're currently pulling together our planning groups, and there's some great ideas already that we've already started, and working with theatres again. So you'll remember we've done things like high intensity theatre lists before now, used virtual reality as a distraction method for do some surgical procedures to avoid having to use GAs, all manner of things that we've done. So if there is anything that any clinical teams out there or non-clinical teams out there have wanted to try in order to improve a patient pathway or reduce waste in any way, or just improve the patient and family experience, please do let me know, because this is the opportunity to do that. We've tried and tested it, and it's not just a flash in the pan. Things like the blood drop clinics that we did are now regular practice. So they really do make a significant difference, and it really is a real opportunity to try something new and just inspire a few people and try a bit of innovation. And then the second thing I just wanted to plug was people will have seen a communication strategy regarding the children and young people's strategy. There's been a series of workshops that have been taken place already, and there's another one today at 5 o'clock and tomorrow at 9 o'clock. So the one today is focused on medical nursing and AHPs, and tomorrow it's managerial and admin. And these are really an opportunity to get in there really and have your say on what we think that the strategy for Leeds Teaching Hospitals Trust should be for children and young people. So that it doesn't matter if we refer to a children's service that is managed by the Children's Hospital or not, what is that level that we're aspiring to, and how do we ensure that there's a standardised approach across LTHT for our children and young people. So if you are able to attend, please do. It's in the communication that's been sent out, and I'm sure Ed will put in the chat the workshop dates, times, and links to be able to join if people want to do so. Thank you.
Thank you, Suzanne. I've answered Emil's question about swabbing for parents. We stopped swabbing parents for COVID. We only swab now if they're symptomatic. There's been a few questions this morning about elective patients as well. We're not swabbing those either. I'll get a communication out today because it appears as though that slipped through the net. And then there was another question from Hannah about IT. I don't know if you can answer that, Suzanne. Do we have a timeline for IT replacement plan, please? We are on our knees in neonates. You're on mute, Suzanne.
Apologies. So the end user modernisation computer programme is the project that is coming in to replace all existing non-Windows 10 PCs and laptops with a Windows 10 PC or laptop. I've asked on Friday for the timescales around then, and it's very vague and being said in the next few weeks. So Hannah, I know that if you want to let me know, I've been working with Natasha regarding the acute problems that are happening within neonates. So I'll pick those up with Natasha, because we've now given out, we had quite a significant amount of laptops to be able to support clinical and non-clinical areas. We've given out, getting on for 300 now across the CSU. and we've depleted our stocks now, so we haven't got any more until our next stock comes in, which won't be for a couple of months. So we need to pick up any issues that are acute and critical as and when they arise, and I'll pick those up with Tasha.
Thank you very much. I think that was all the questions. Ed's popped in those workshop dates and times, and yeah, I can't reiterate enough how important it would be to attend if you can, and to be able to give your input and thoughts. So thanks everybody, have a wonderful week, and we'll see you all for the Muddle next week.
Thanks everyone. Bye.
Thanks, Celia.
Thank you.